All right. Okay. Good afternoon, everyone. Welcome to our vision screening training for VMRC. So this meeting is going to be recorded and eventually we will post this on our YouTube page so that you guys will have access for future reference. I think Doug will also be able to post this on other social media page like our YouTube, but some people, oh no, like I meant Facebook, but other people doesn't have Facebook account. So the easiest way really is to post it on YouTube where a lot of people have easy access. And how do I move to the next screen? There. So for public disclosure, nothing really to disclose. This is not supported by any other companies or commercial companies. Well, I guess a disclosure that I'm going to make to you guys really is that I'm sure you notice I'm so far away from my camera. It's because I have an infection in my eyelid. How ironic is that, right? I'm teaching you guys this vision screening and I have something in my eye. So I'm trying to be away from the camera so you don't see that. It's a blepharitis, so I have it right now. So yeah. Okay, so we have here our learning objectives. We're gonna go through this quickly, and then we're gonna be opening up for any question and answer portion. So we'll just do a really basic anatomy of the eye. I don't want to bore you with that. It's just really what's going to be useful for you when you're doing the screening. And then we want to discuss, of course, what is the normal expectation for each current age level of the child. So that's why we have the developmental milestones. And then we're going to go straight to our functional vision screening. Okay. All right, so for the anatomy of the eye, we have, of course, here your eye. It's basically showing the basic accessory structures. You have here the eyelids. This is where I have my infection over there. The eyelid is over there. And then the eyelashes, and you have your eyebrows. Your lacrimal tearing apparatus will be over here. You have here your pupils, the one that is black there is the pupils, and you have your iris. The iris is the fun part that has different colors. Most people have brown. There's blue, there's gray, there's green, there's hazel. And some albinos actually have red iris because you could see through the blood vessels because they don't have melanin in their eyes. So that's just interesting. And then here's another part of the eye wherein you could see here basically, here's the lens. This is the part where it gets cloudy eventually as you grow older. And that's also what we kind of like look. Some kids have congenital cataracts that this part is cloudy and it gets changed. It could get replaced. As you grow older, of course, you know, cataract could be because of injury, exposure to UV lights, medications, or certain health conditions like diabetes. Here's your macula, and your fovea is the central vision, the sharpest vision in your eye. You have all your rods and cones there, your blood vessels going there. This is like a side area, a side view of your pupil there and your iris. This picture, I just got it because I wanted to show the lacrimal apparatus. We don't really see that because we just see the punctum over there in that areas, but really inside, this is how it looks like, this lacrimal apparatus that sometimes gets clogged, and then you'll have a blocked tear duct, and then the eyes will get watery, teary, irritated. It's going to be red because all those tears can't drain. There's also this interesting to show that there's also some lacrimal glands here and that are there in this part of the eyelid. And then I got this slide because most of the time people get confused as to the specialists which one does. So just to clarify, Ophthalmologist is really a physician who specializes in the diagnosis and treatment of eye disorders. They give drugs, medications, they do eye surgery, they also do corrective lenses. Ophthalmology is the study of the structure and function of the diseases of the eye. And then you have the optometrist. An optometrist is a specialist with a degree in optometry who is licensed to examine the eyes. They test the eyes, they treat any visual defects, and they do prescribe corrective lenses as well. And then we have, of course, the optician. And the optician is a technician who does the fitting, adjustments that are needed for our corrective lenses. They dispense the corrective lenses, but the prescription really came from either the ophthalmologist or the optometrist. So the optician is the one that dispenses on whatever the ophthalmologist or optometrist gives as to how the lens should be. Okay, so from there, we're going to jump on to our developmental milestones. So for that, we're going to begin with the birth to first month. So what are we expecting from birth to first month? So in that, the baby usually begins to focus on lights and objects that are really close to them, really an average of just 1 feet away from them. And they begin to look at those slowly moving lights. So that's why we have, most of the time, we have those things on top of I forgot the name now, but the ones that are on top of the bed that kind of like rotates for babies to see. It's really too far usually, but we really wanted it to be just a feet away. So toys like in this picture, that is too close for the baby to see and appreciate really. So that's what you're expecting them to see when they are just newborn and up to their first month of age. And then during their second to third month, you begin to notice, the baby begins to notice their hand. They kind of like look and see at their hands. They make eye contact with a parent, a caregiver. Still, they continue to follow those moving lights, but also they try to focus now more on the faces really of those people and with their eyes. And they start to show that social smile as well. This is really the fun part where, I'm sorry about the background. You're hearing my dog. This is where the fun part where really the baby has that social smile where they begin to smile at you when you talk closely enough to them, still about 1 feet away. So that's really the beginning of that. And then at the third and fourth month, this is where the baby, you can see in this picture, the baby's watching his or her hand. They just really discovered it, and they discovered that it can do other hand movements. So they're like fascinated by it. They reach for objects. They start to reach for the caregiver or the parent's face. They try to hold objects. They grasp things. So rattles, they really try to hold tight on them. And that's for third and fourth month. And then for the fifth month, the baby's eyes now appear straight. So there are times that when they are younger, when they look at you, it doesn't seem straight like this one. But by fifth month, you are expecting them to appear straight. So, you know, sometimes you would hear pediatricians say, oh, that's okay, it would still adjust. So that adjustment has to happen by the fifth month, and it has to appear straight by the fifth month. So neither of the baby's eyes should be turning up or down or in for several minutes at a time, whether it's constantly or intermittently. So this is an example of when the baby's eyes at fifth month is turning in. So this baby's eyes, this right eye is turning inward towards the nose, the nearest area here. So we don't want that to happen. So that is a red flag that we want to refer the baby to the pediatrician, and most likely the pediatrician will refer to a pediatric ophthalmologist. For the sixth and seventh month, we see babies really trying to reach for objects purposefully, and they try to follow those with their eyes. And those that are near them, they try to follow. So if you put an object like around here on this part, the baby sees it and the baby will try to go for it, go after it and follow it and try to get it and grasp it. And then by 8th to 10th month, the baby really recognizes the face of the caregiver, and they look at small objects like raisin or cereal. Like in this picture, this baby has an eyeglass. So once the baby had the eyeglass, the baby now recognized the face of the father. So that's really nice. That social smile, really the baby's, you can see that the baby here is looking directly to the eyes of the father, which is nice. They're having that nonverbal communication right there. I'm sorry. Okay, so for the 11th to 12th month, the baby, you want to use this milestone and see, does the baby has been exposed to a book or not? So if a baby has been exposed to a book by 12th or 11th month, then you want to see that the baby is able to point their index finger to a picture in the book. So like in this picture here, the baby's trying to point at an area in the book because the baby has been exposed to a book. So they're kind of like, it's like as if they're reading something. So that's what you want to see by 11th or 12th month. That's what you're expecting them to see. And then by, why is it not moving? And then if the baby has not been exposed to books, you want to expect the baby to look for objects that have been dropped in containers. So like in this example, the baby has like a big container and they drop something and they try to look for it and try to grasp it. And you're expecting that they're trying to look for that object in that container. So those are the milestones. Really, the basic ones are from birth to 12 months. So that's the one that we're going to be discussing here. And then after that, we're going to be moving on to our vision screening. So our vision screening, we really wanted to make it more user-friendly to all of you. You know, with COVID, we know that most of you are working remotely. The assessments, the interactions that we have with parents, it's really done through video conferencing or even sometimes telephone. So we want to make sure that we are able to use a tool, because our vision screening is a tool for us. We want to make sure that we have this tool to continue help us in assessing our kids, but at the same time, we still have all the basic elements that we want to identify those kids that are at risk, or we still identify any red flags for our kids. And so for this one, I'm going to be showing you, you're going to be seeing like all these white aspects. It's like a cutout of the paper of the actual vision screen. So I made it in this way such that it make you familiarize already on what it will look like. So we made it in such a way that the first part would be the history. So you want to ask the parent or the caregiver, do they have any concern about the child's vision? Anytime a parent or a caregiver has a concern about their child's vision, you really want to refer that to the pediatrician so that they will be able to investigate it further. So that's why that is the #1 part in our questionnaire there. And really, American Academy of Pediatrics recommends that the pediatricians does really a vision screening as well with a child every time they go in for their well child checkup until they are 30 months. So either the pediatrician or their primary caregiver, they really have to perform an actual vision screening during that time. And also at 3 years old, 4 years old, and 5 years old, using eye charts and other autotype vision screeners that they may have in the clinic. And then we also want to ask, does anyone in the family have a vision problem? So we placed here other than wearing eyeglasses because we're assuming that most people who wear eyeglasses are usually because of old age. But if somebody has in their family wearing eyeglasses since they were very young, for example, the mom has been wearing eyeglasses since she was like 4 years old, then that is one of the family history. And you can write there that here in the concern that yes, there is a concern because the mom has been wearing eyeglasses since she was 4 years old. So anybody that you have that, anytime you have that in the family, that is also a concern that we want to point out. And we want the pediatrician and the primary caregiver, primary provider be aware of that so they can follow that whenever they're doing that vision screening during the well child checkup. And then we also want to know if the child has had previous vision tests, and then what are the results in here. The next part of our vision screening would be focused on the vision behavior. So this is one of the big difference that we made in this vision screening is that we remove the part where you're going to do a lot of really physical examination. It's going to be more on direct observation and the parents' best judgment really on what they see their child is doing, since they're the one who's with their child 24/7. So they know what their child is doing. They know what they are exhibiting. Is there any behavior that they think would be a concern? So this is what our vision behavior will be focused on. So you want to ask them, does the child have any eye contact by 3 months of age? Does the child bring objects very close to their eyes, or is the child like kind of bringing an object really close to their eye to kind of like see the object? Is the child tilting their eye in a certain angle when they're trying to look at an object? Do they make any eye contact with the parent or the caregiver, or do they not do that at all? This one could be kind of like two different things. You want to rule out that there's no vision problem, and at the same time, if you've ruled that out, then of course, I know with us here, we kind of like think as well, is there any red flags there for autism because there's no eye contact? Although, as we all know, I'm sure you all know as well, not all child with autism does not have eye contact. There are kids with autism that have a good eye contact. And then does the child display little interest in visual stimuli? You know, parents buy all these nice toys that have lights, and we want to see that the child is interested in that. So if the child is not interested in that, that's kind of like, you kind of like question that. And so that's one of the red flags. And then the child does not display protective response. So, you know, sometimes you move quickly and then the child blinks or closes their eyes, or of course they kind of like move away also. So if they don't do that, then that is another concern that we want to make sure we investigate further. So we want to make sure that the family, when they go back to their primary care for their well child checkup, that is a concern that will be addressed at that time. Also here, we want to know, are they hesitant to reach out for objects? Because maybe they're not seeing that object. Do they reach for the caregiver's eyes, their face? Because remember, they are able to see their caregiver's face, and they are supposed to be reaching for their caregiver's face as early as 3rd or 4th month. So if they're not doing that, then we want to know, why are they not doing that? And then when they're trying to reach for objects, are they underreaching or are they overreaching? Are they having excessive sensitivity to sunlight or squinting their eyes when there's light or bright lights? Do they frequently bump into objects when they're walking or crawling? Do they trip on the curbs, on steps on the floor? Do they, when something drops, like what we showed here in, I don't know, like this one, when something dropped, are they looking for it or not? Are they interested in looking for that toy or not when it dropped inside whatever container or just dropped? Yeah, so that's for the behavior part of our vision screening. So after that, we move on to the eye structure or the eye movement. So we want to look at the pupils, you know, the black shape that we showed a while ago. Are they equal in size or are they unequal? Sometimes there are pupils that are irregularly shaped. There are pupils that are like tear duct shaped. So you want to know that, and we want the pediatrician to investigate further if that's the thing. The pupil of the eye is not black, so we want to know that as well. One or both eyelids are drooping. This is sometimes called the droopy or the lazy eye. Is that happening with the child? Does the eyes does not completely close when the child is sleeping? This one is important because when the eyelid is not completely closed, then it would be exposed to air and dryness. It could even cause corneal ulceration. So you want to address that to your caregiver so they can reach out to the pediatricians and address this. Is the child showing any unsteady, shaky, or jerky movement of the eye? That's called nystagmus. Is it rolling upward or downward? Does it seem cloudy? This cloudiness is what we want to look for when you're looking out for congenital cataract. It will be cloudy. So you want to ask them for that as well. Is there abnormal tearing or redness? Remember, we talked about when that tear duct is blocked, it's going to be irritated because the tears are not draining. So that's why it's going to be tearing us and red. Does the size of the eyes appear abnormal? Are they equal? One is big and one is small. And then we talked about strabismus, wherein one of the eyes appeared turned in or crossed or looking outward or turning inward. So the next one, I'm going to show you some examples of pictures of what some of these may look like. So here one, this anisocoria or unequal size pupil. So you can see the black here, there's this black pupil, it's big. And then compared to this one, it's teeny tiny, it's almost pinpoint. So if you're going to measure that, this is probably about an 7 to 8, and this is probably just about a 3 millimeter. So that's an unequal pupil. And then with this one, you can see the cloudiness in there. The pupil is not black. There's cloudiness in there that's happening. So you want to address that as well. You want to tell the caregiver, bring your child to your primary care provider and have them investigate that. Maybe they might need to refer you to pediatric ophthalmologist. And this is when we were talking about a while ago, both eyes appear to be in equal size, or one is small and one is large. So this eye is what you call the microphthalmia. It's very small and little. This has a bigger potential of having visual acuity problems, and so sometimes there could be a need of replacing the eyeball. And then this one is the strabismus, wherein the other eye is looking inward. So this eye is looking inward. This picture is actually showing you one of the tests that was in the previous vision tool, wherein the red reflex, corneal red reflex, wherein you shine a light and then you see the white. So that's the white light. It should be in the middle, and this eye is normal because it's in the middle. This one is the one that's turned in. So your white light, when you shine, it's here on the side. So it's turned in, and the light is outside. So but you don't really have to do that, because you could ask the parent, and if they tell you, then yeah, the child has it. Another one here is the lead lag, the lazy eye or the droopy eyelid. So this one is a child which obviously has a droopy eyelid over here. This eye, when you ask the child to like open their eyes, this one is bright and really showing the eyes really nice. And this one, it's not. This second picture here, I wanted to show you because the one here on your left, when you're looking at it, is the before, and the one here on the right is the after. So it's a very subtle lid lag. That's why I wanted to show it to you. So this eye has a very subtle lid lag here. You almost don't notice it unless you really pay close attention, while this one is really wide open. And then when they did a repair, you see how now it's wide open, similar to the other one. So those are sometimes subtle lid lags. It's very subtle. So I just wanted to show you that example. And then I wanted to show you some resources. So these resources, I'm going to post a copy of a link of this PowerPoint when we post the video. But at the same time, I want to show you these resources right now, where I've got some of the tools that I've shown you, like that developmental milestone. So if you guys are interested to kind of like investigate further, read further, I will give you that resource. Let me look where it is in my screen. Here. Alrighty. All right, so we're gonna go to this one first. So this is, let me just move the remote, the controls are blocking my, okay. So this is where I got that developmental milestones, and the questions I basically cut and paste. So you guys see it has a detailed explanation and on the other side on like what you have to do. But I really wanted you guys to focus more on what am I expecting at 1 month old, at 5 month old. So I wanted to show you, this is where I got that from. It's a nice resource if you wanted to delve more into it. And then this is what, like, if you wanted like a quick reference of that milestones, this is like a cute one where you can have it all there. I'm gonna make it smaller so you guys can see like a full view of that. Yeah, so it has there for the first month. I'm too far on my screen. So it has it all there until 12 months. There you go. And then here, this one I wanted to show you because it's, you know how you have sometimes parents who really, really wanted to know more. What can I do on my part to be proactive, to help my child with their vision? So this is a very good resource to give to parents. It tells you here, the milestones that they should be expecting. But at the same time, what I really like is it tells you what you can do to help your child develop their vision. It gives strategies to parents on what they can do on their own. In every month, it's in here. It's addressed at those milestones, developmental milestones. And so that's why I like this part to give to parents as a resource if you have any parents that are really proactive into helping their child with their vision. So this is a very nice resource. And then all of these links that I'm showing you is in this websites for National Center for Children's Vision and Eye Health. So this links and downloads, that's where I got it from. So this vision developmental milestone, they have the guidelines there, the guide to health. This is what for the parents are. So the website, this website is actually on that resource page of the PowerPoint that I have for you. So you guys can access that whenever you want to, okay? And actually, let me go back to the slide. So after these resources, actually, oh, I forgot to show you these ABCs. Let me show you the ABCs. So the ABCs, I have it there because for older kids, what they are recommending is this ABCs of observation, which is basically what's in our questionnaires as well, in our vision screening. So there it says the ABCs of observation. So you want to see the appearance signs, which is what we are looking for already. Is it cross eyes, their cloudiness, unequal pupil, droopy eyelids, and then behavior signs as well. Is the child clumsy, tripping on the corner when they walk? Are they looking at an object tilting their head or squinting their eyes. The only thing in addition here is, are they, and this is more really for an older child, are they complaining of headache, nausea, or dizziness? Are they always scratching their eyes? Which this could also, you can also ask their parent, do you notice your child scratching their eyes a lot of time or itching their eyes? So you can ask them about that as well. Unusual sensitivity to light, squinting their eye when they're in bright light or in sunlight. So this is what this is also, which they recommend for kids that are older than 12 months of age as well. Okay, so resources, and then here's the references. So basically that is our vision screening for all of you. I hope that would be more useful during this COVID time for doing remote screening when you are with your families and the kids, and really asking the parents on what they observe on their child. And so I'm going to be opening up the floor to any questions. And you are free to unmute yourself when you have any question. I'll probably stop sharing this so you could, we could all see each other. There we go. Oh, there's a chat. Okay. Alrighty. So yeah. Anybody you have a question?
I do, Claire. It's Debbie.
Hi, Debbie.
Do you want us just to put down the observations of what we saw, what was indicated? Do you want us to put a pass or a fail? I'm just kind of curious how you want it, and what would indicate a fail if it's pass fail? Like if there was one thing on the history, would that be a fail?
Yeah, well, if there is one thing in here, like for example, in the eye structure, if one thing is checked there, you want them to go and refer to their pediatrician to have that investigated. So we didn't do the pass fail, because what I did was before I proceed on really changing into this format, I asked a couple of regional centers on what they do for their vision screening, because I want to make sure what is in my mind is accurate, is appropriate. And so they have very similar vision screening to what we have right now, wherein you identify any red flags, and then if there is something, you tell the parent to go to their pediatrician to have it investigated further. So that's why we have more of a, you could call it a checklist now, wherein you check anything that applies to them, which we basically enumerated all our red flags there. And then we will recommend for the parent to go seek further evaluation with the pediatrician. And then the pediatrician will then decide if it needs any the specialist, a pediatric ophthalmologist. The previous one that has more of a physical examination, I didn't feel comfortable having you guys do that, because really most of us who would be doing that is not in the medical field and is not really trained to do physical examination. So I don't want to give that burden to you guys. And then plus the fact that we're in COVID and we are doing all these remote evaluations, it's going to be harder as well to do that. It's more useful for us to have a tool that we can get enough information, but then it's also enough that we don't lose or miss other kids that have any red flags. So I wanted to make sure it's like that. Does that answer your question, Debbie?
No, I'm still not clear how you want the wording, like on the report. I understand, like if something comes up, refer them to their family, but when is it, do we put pass fail, or do we just say these are what was observed? They visually track, but family has a history of early eye problems. If the family has a history, like mom had glasses when she was 4, one of your examples, do we just make sure mom makes the doctor aware of that, or is it a fail?
So we're not
sure how to word it.
Oh, it's okay. No, and sorry, yeah, we're not gonna put any pass or fail on this one. We are definitely, as you mentioned, going to ensure that we encourage mom that they go to their pediatrician if there's, for the history part, if there's any high risk in that one. Because, for example, the mom, as we used already a while ago, the mom was wearing glasses when they were 4 years old. So that is a high risk for that child. So we will want the child to go be evaluated by the pediatrician. And usually, really, every time that they have their well child, they should be doing that screening, vision screening as well. So yeah, but I know not all. There are some who are not able to meet their well child checkup as often as they should be. So we want to give that reminder as well.
Hi, it's Nikki. Hi, Debbie. So actually what I see in the box instead of the pass fail like we've done in the past, it would be your comments and observations. So what prompted, was the parent not concerned? Everything looked great, just more of a narrative and a summary of what you guys have interviewed and found out. If there's a concern, certainly we would put it in a narrative format saying what that concern was. And then that would prompt the service coordinator to go ahead and send that follow-up letter to the primary physician. So it's a little different than the past, but we still need some type of narrative of what you've observed, what the parents reported, and if there's any concerns or no concerns. But it just implies that we had an interview with the family and observation, and we feel pretty good, or we really do have concerns and we need to move forward. So did that answer your question?
It does, it does.
Okay.
And then in the recommendation section, do you want us to recommend the child contact the physician or the family contact the doctor for blah, blah, blah? Or do you want to we've put it in the narrative and the service coordinator will bring it up?
Claire, I'm not sure, but either way would work.
You can put it in the comment section. Yeah, I forgot to mention, and thank you for pointing that out, Nikki, that is also why we still kept that notes comment section, so that the observer who is doing that vision screening can still have that flexibility to put in their input, their actual input, if they have observed something, either it is remote or it is face-to-face visit, whatever you feel that is appropriate to put in there that is notable, then yeah, please feel free to use that notes and comment section.
And also the section on the IFSP under the developmental, the ages, the boxes, I always say the developmental boxes, but, also in that section in the hearing, I mean, we have it recorded there. That's something that's given to the family, and then they can, present that to the doctor also. So I think both those on the actual tool, and then in the comment section on the IFSP under vision would probably be the best location so that the parent has something to refer back to.
Thank you.
Definitely.
Yeah.
Thank you for pointing that out, Nikki.
Thanks, you guys.
Okay.
Any
Hi,
other questions?
Emily. Yeah, this is Emily Hawley. My question as an ABA service provider, what's our role in this? Are we going to be getting vision screening information in referral packs? Are we supposed to be doing it? What are we doing when we get our referrals?
Hi, Emily, it's Tara. Olivia is going to be sending you guys out a packet of information.
Okay.
So you should have it probably tomorrow or Monday. And it'll have instructions, but yeah, you guys will be doing this.
Thank you so much.
Nice to hear your voice.
Nice to hear your voice too. Nice to see Kazoo and Linda. It's my old compadres when I was out at Regional Center. Hi, sorry my camera isn't working. All right, thank you, Tara.
Thank you, Emily. Any other questions? I don't hear any questions. Do you guys feel that this is going to be useful for you?
I have a question. I'm wondering
Okay.
if you'd be able to provide perhaps an example or a template of how you want your providers to report on this. I know we can all probably describe it pretty well, but just to make sure we're aligning with what VMRC wants us to do.
Yeah, we can definitely send a template for that. Like what to put on the notes and comments?
More so on what we would write in our reports. So if we're doing this during the assessment period, just kind of where we would place it in the report, what kind of formatting would you want for it, etc.
Okay. All right. Yeah.
Okay, thank you.
You're welcome.
I have a question. When you talk about the developmental ages for the milestones for the vision, are you taking into consideration prematurity or going off the chronological age only?
Yes, that is a good question. So when a child is premature, you're definitely gonna consider that and subtract that to get the developmental age of the child, because we don't want to use the chronological age when a child is premature.
Okay.
So you're gonna go by months, definitely. So if a child is 20, let me show you. And I forgot to share that as well. But yeah, that's a good question. Thank you for bringing that up. So it's here actually. They mentioned it here as well. You want to make sure that if a child, for example, is at 24 weeks chronological age, so you will definitely subtract that to the chronological age. Why am I not getting it correctly here? So for example, chronological age is 6 months, child is born at 28 weeks gestation. So 40 minus 28 is equals 12 weeks. So you're using chronological age of 24 weeks minus 12 weeks equals 12 weeks. So you're basically using 3 months as the developmental expectation for your child at that time. I'm sorry about that. My daughter. Just a minute, Hannah. All right. I'm sorry about that. Was that clear or?
Yes, thank you.
Okay, thanks. Any other questions you have? Oh, okay. I see some questions here on the chat. Should we still use the same template we are currently using, or can you provide the template you were reading off? Yeah, we are going to provide the template that I have read to you guys, and you can start using that. Where I'm gonna have the managers, Linda, Nikki, Kazoo, Trisha, and Linda, forward you guys a copy of that vision screening so you guys are able to use it. Okay, I think that's all, because the other question here we have addressed already. Provide an example of template. Yep. All right. Any other questions? You guys are good? No questions? But we are going to be posting this on, as I've said, on our YouTube page. So if you guys need that for reference, it's going to be there. I'm hoping maybe within this week, because usually I get the recording from Zoom about less than 10 minutes, 5 to 10 minutes after the meeting is over. Zoom sends me the link. And so I'll ask one of our staff to post it on our YouTube page. So it will be there for you guys, and also on the Facebook page of VMRC. Alrighty. Okay, and then I will ask our managers, Kazoo, Linda, Nikki, Trisha, and Linda, to give you guys a copy of that new vision screening form. I hope it will be useful for you during this time of most of our remote assessments. So I really hope that will be useful. Well, and I appreciate you guys coming. Thank you guys so much. And if you guys have any questions, just send an email and I'll do my best to answer you guys. What date should we switch to the new form? Well, we're actually going to use it now. So once you get the form, you can start using that, okay? So that we'll have an easy way of transitioning. And it's going to be posted, as I've said, this video is going to be posted for future reference. If there's no other questions that I'm seeing in the chat and here, I'm going to be saying goodbye to you all. I really appreciate you guys for coming. Thank you guys so much. Okay.
Bye, Claire. Thank you so much.
Bye.
Thank you, Claire.
You're welcome. Bye.
Bye-bye.
Bye.